Universal healthcare refers to a healthcare system in which every individual has access to the necessary medical services, regardless of their financial situation, employment status, or other personal circumstances. The goal of universal healthcare is to provide comprehensive, high-quality health services to all citizens without causing financial hardship. It generally encompasses preventive care, treatment for illness or injury, mental health services, and sometimes even dental and vision care, depending on the country or system. Key features of universal healthcare: coverage for all. Universal healthcare ensures that everyone, without exception, has access to healthcare services. It doesn't matter if a person is rich, poor, employed, unemployed, or even undocumented in some cases. No one is excluded from receiving care. Access to essential health services. A universal healthcare system typically includes services such as general medical care, hospital care, maternal and child health, mental health, chronic disease management, emergency care, and sometimes dental and vision care. Equitable. One of the key principles of universal healthcare is equity. This means that access to health services is not based on income, wealth, or social status. The goal is to ensure that everyone receives the care they need to live healthy lives, no matter their circumstances. Funding through taxes or contributions. Universal healthcare is typically funded through a government-run system, with citizens contributing through taxes or insurance premiums. This pooled funding allows the government to negotiate costs, control expenditures, and ensure that the healthcare system remains affordable for all. Types of universal healthcare systems. There are various ways countries implement universal healthcare, and they vary in terms of financing, delivery, and control. Some of the most common models include single-payer system. In a single-payer system, the government is the sole provider of healthcare funding. It pays for all healthcare services, usually through taxes. Healthcare providers, like doctors and hospitals, may be privately run, but the government reimburses them for services rendered. For example, Canada has a single-payer system where the government covers the costs of healthcare and private providers deliver the services. Multi-payer system with government regulation. In a multi-payer system, multiple insurers, both private and public, provide coverage, but the government regulates the system and ensures that everyone is covered. The government may provide subsidies or mandate employers to offer insurance to employees. Germany is an example of this system, where the government sets regulations and establishes an insurance pool for those who cannot afford private insurance, but people also have the option to buy private health insurance. Social health insurance system. In this model, health insurance is provided through nonprofit entities that are often funded by payroll taxes or premiums, and the government enforces rules to ensure that coverage is universal. An example is France, where the government works in partnership with private insurance companies and employers to ensure that everyone has healthcare coverage. National Health Service (NHS) model. The government not only finances healthcare, but also owns and operates healthcare services directly, such as hospitals, clinics, and medical personnel. Doctors are typically government employees. The United Kingdom's NHS operates under this model, where most healthcare services are publicly funded and provided. Advantages of universal healthcare: improved health outcomes. By ensuring that everyone has access to healthcare, universal healthcare systems can improve overall public health. People are more likely to seek preventive care, early treatment for illnesses, and ongoing care for chronic conditions, leading to better health outcomes. Financial protection. Universal healthcare reduces the risk of individuals facing catastrophic financial costs due to medical emergencies or long-term illness. People are less likely to go bankrupt or fall into poverty due to medical expenses. Preventive care focus. Universal healthcare systems often place a strong emphasis on preventive care, like vaccinations, screenings, and health education. By addressing health issues before they become serious, these systems can reduce the need for expensive emergency care. Health equity. By removing financial barriers, universal healthcare ensures that access to care is more equitable. Vulnerable populations, such as low-income individuals or marginalized groups, are less likely to be excluded from needed services. Challenges of universal healthcare can be quite complex. First, there's the cost. While universal healthcare reduces individual medical expenses, the overall cost to the government can be high. Funding for the system typically comes through taxes, which can be a burden on taxpayers. There may also be debates about how to fairly distribute those costs. Wait times are another issue. In some countries with universal health care, long waiting times for certain types of treatment or elective procedures are a common issue. This is often because demand for services can exceed the availability of providers and resources. Then there's the balance between quality and access. Some argue that universal healthcare can lead to lower quality of care, especially if resources are stretched thin. However, many universal systems like those in the UK or Canada generally provide high-quality care despite these challenges. Political and public opinion also play a significant role. Implementing or maintaining universal healthcare can be politically contentious, especially in countries that prioritize free market principles. Opposition to universal healthcare often comes from concerns about government overreach, taxes, or fear of inefficiency in the public sector. Let's look at some examples of countries with universal healthcare. Canada is known for its publicly funded single-payer system. Healthcare is free at the point of service, and the government funds services primarily through taxes. In the United Kingdom, the National Health Service, or NHS, provides and funds healthcare, with the majority of services available for free at the point of use. Sweden provides universal healthcare largely funded by taxes, with the government overseeing much of the system's organization and funding. Germany offers a multi-payer system where healthcare is funded by a combination of public and private insurers, with the government ensuring universal coverage. And in France, a social health insurance system covers most residents through a public health insurance program funded by payroll contributions. Now, let's talk about universal healthcare in the US. The US does not have a fully universal healthcare system, although it has some programs aimed at covering certain groups of people. Medicare provides health coverage for seniors and some disabled individuals. Medicaid covers low-income individuals and families. The Affordable Care Act, or ACA, aimed to reduce the number of uninsured Americans by providing subsidies and expanding Medicaid in some states. However, the U.S. still has a largely private insurance system, and millions of people remain uninsured or underinsured, leading to ongoing debates over whether to adopt a universal healthcare system. In summary, universal healthcare aims to ensure that all individuals have access to the healthcare they need, regardless of their income or social status. While it offers significant advantages in terms of public health and financial protection, it also faces challenges related to funding, wait times, and political feasibility.